Good morning, ladies and gentlemen. My name is Michael Christian, and I am a United States Marine retired veteran and homeowner in the Oxon Hill community. Today I'm going to be discussing with you guys the importance of dietary reference intakes and improving it within the community that will then correlate to an improved public health. The challenges of food inequity are extremely prevalent in underserved communities such as Oxon Hill, where there is things such as food deserts, food swamps, and a lack of health literacy. By addressing these key issues, we can have a positive impact on the individual's well-being that will in turn have an effect on the public health of the entire community and hopefully branch out towards the entire country, but one small step at a time. So some key points can be community-based health education that we can use in order to properly educate the individuals within the Oxon Hill community and the PG County community by addressing these underserved populations, as I stated earlier. And the problem is that many low-income areas, they tend to just lack the education and or are food deserts with limited healthy food options available for them. So it's not even a matter of that the individuals do not want to eat healthy, but they are unable to due to the lack of healthy options available to them and or transportation to get to these healthy establishments in order to buy healthy food. It's easier to walk down the street to the Hip Hop Fish and Chicken than it is to hike to the supermarket, buy a shopping cart full of groceries, and then have to hike back with the groceries. I've done that myself. It is a lot of work. And of course, the individuals might not be inclined to do this work because they don't understand the amount of vitamins and nutrients that they are lacking by avoiding the healthier food options due to circumstances that can be mitigated or at least reduced. So the goal is to emphasize the urgent need for a multifaceted approach to address these interconnected issues. Diabetes, obesity, hypertension, and heart disease were the leading chronic diseases within the PG County community. Why this matters. The importance of this is that the public health and nutrition is what I like to call a domino effect problem. By addressing the first domino, which is the individual's nutrition, we can then address further dominoes down the line, such as low income, which could be due to poor work availability, due to poor health. These things can also correlate to an increase in crime due to lack of available food and resources that can affect things such as mood and things such as work-life balance. So by addressing these public health issues, by addressing the public health issue of nutrition, it can then correlate into broader terms of how we can be a healthier community. This could include things like chronic health diseases, which we are high in the whole United States, but PG County is what we're talking about primarily, is at risk of. People with higher levels of health literacy are more likely to use more preventative healthcare measures, and those preventative healthcare measures are what's going to keep them in the work environment longer. It's what's going to help lower the healthcare costs within our community, which we can then pour that money from the community into other avenues that require our attention. And they are more capable of applying their knowledge and skills to health practices, thereby reducing the risk of chronic disease. So we have some current challenges in District 7 that kind of get in the way of us addressing this problem at the root cause, because the goal here is to treat the root cause, not treat the symptoms. And this would include things such as limited access, like I mentioned earlier. So that's limited access to these healthy food options. That's going to be your food deserts, your food swamps, things of that nature, and transportation, as well as economic barriers, which is that healthy eating is expensive nowadays. In the beginning of my slideshow, I showed a small receipt where you can see the quantity of what's in my cart and the pricing of everything that I bought from the cart. And this is from the closest Costco to us. And you can go and spend hundreds of dollars on food from a Costco when we can instead have farmers markets dedicated in the community that bolster community togetherness or unity, as well as provide healthier food options that we can have at more reasonable pricing due to tax incentives that are around in order to better assist the individuals. And of course, there's going to be some educational gaps as well. These educational gaps aren't necessarily that we are behind in terms of how we educate the individuals, but more so we do not stress, or we could stand to stress more, health literacy and give classes out of community centers and things of that nature in order to better address the situation. So program design. Our program design is a multifaceted approach. I've done some extensive research, and it's been shown that a multifaceted approach to many problems, to especially community issues, is great in order to address the root cause of the problem. So that will be through the process of surveys. So we need to do some research surveys to get a proper climate check on how our community is. We need to have tailored curriculum and incentives, which is the tailored curriculum will be addressing the actual problems. So we can expand some to our, we can partner with local vendors and farmers and things of that nature. Maybe provide them subsidiaries in order to give them more incentive to grow more and reduce the economic burden or financial load that the farmers have to front in order to produce the produce that we need, hence making them grow more. And then public awareness campaigns. Social media is prevalent right now. It's extremely prevalent, and we need to capitalize on that, because a lot of these issues, we can address at another root cause, which would be our youth. By instructing our youth from a young age how to eat right, they can then teach their children and their children how to eat right simply by just behavior and less by education. Which education is still important, but it'll be more behavioral influence than a education influence. And they're not telling these kids what to eat. They see mommy and daddy eat these foods, and they also want to eat these foods. I like to think I have an outstanding diet, and that's mainly due to the fact that I came from an environment where I can pick mangoes from various trees and or coconuts, and there's an abundance of fruit and vegetation around where we can indulge in. And we don't necessarily need to go to the hip-hop chicken, because we have such tasty quality food right here in our back doors and in our backyards. This multifaceted approach will be through education and access. So we've launched some pilot programs, and some of our pilot programs include community center education classes, seminars, and classes where we basically put up forums and flyers in local areas, parks, things of that nature. We have started a social media page where we produce TikToks and Instagram reels and things of that nature in order to spread the word to the local community that there is classes being conducted where we are finding fun ways to incorporate healthy eating. We have been improving access to healthy foods by partnering with CSAs and cooperatives to increase availability and affordability of nutritious options. Through surveys, we've seen some positive dietary shifts. Individuals are incorporating more fiber into their diet. They're doing small things like adding a bag of flax seeds to their meals, which is cheap, inexpensive, hardly alters the taste, but increases the potency of the nutrition that they are consuming. And policy engagement. So we've been advocating efforts and initiating dialogue with elected officials. Right now I'm trying to have some dialogue with you as an elected official in order to spread the progress, and not just the progress, but the inclination and the drive, the initiative to want to have better healthy eating and living. Of course, something like this will have a cost, and right now I have listed some of the estimated costs for the program so far and the pilot so far, as well as so far what we require in order to keep this sustained and running. So this is going to be the rough numbers of the budget that we have put in place, and we have a certain strategy in order to make sure that we can reach these numbers consistently without having to rely too heavily on community and government funding. So some of these things to include federal public grants, so local, state, and federal agencies, wherever we can get grants that are applied to the avenue which we are trying to pursue right now, which is improved nutrition. We are going to be looking for and applying for those. Private philanthropy. So of course we have a lot of many individuals who want to donate to the cause, are more than welcome to donate to the cause, and by spreading the word, we help increase traction and vision to the problem in our community, which is improper nutrition. Corporate partnerships. So by partnering up with certain corporates, we can help invest into the businesses, and the businesses will then invest more into producing quality food. Social media revenue. By spreading the word on social media and TikToks and Instagram Reels, we are not only making sure the entire community gets proper education and insight onto nutrition and how it links to chronic health disease, but we also can produce revenue from this social media, and the social media can cover not only just the nutrition, but as a PG County social media platform, we essentially are building an audience and a following that can be used for other aspects of the community outside of nutrition, so that makes it multifaceted in nature and beneficial all around. And then community fundraisers. So hosting simple fundraisers, we can have we can do something where we have the farmers markets and everyone else show up, local homeowners, things of that nature, who do DIY things, arts and crafts, food, culinary. We can host community, essentially, fundraisers and parties at local parks, and that will also increase nutrition by having quality nutrition at the location, as well as increasing community unity. So recommendations and next steps. So some recommendations and next steps is to scale up this multifaceted approach even more. So that's to expand our bi-weekly meetings into maybe weekly, if that's, and then as well as expanding it outside of our initial Oxon Hill community and PG County community to the whole DMV area, maybe starting with Maryland. Strengthen policy advocacy. So we are already working hard on advocating for this policy. So just continuing on with that efforts, networking, getting to know more individuals, working our way up the echelon of the political powers to get some insight and some traction with this program. And we need to address engagement barriers. Some of these barriers are including limited access to social media, limited access to these events to get there. So a way we can mitigate this is making sure that they're at reasonable times where individuals can get off work and not feel like they have to go then sit in a classroom. We can maybe host these on Sundays after religious gatherings, and or when it's just a more relaxing day for individuals, so that way they can better understand what's going on in our communities. Monitor and evaluate, of course, so that's through research and studies. We can monitor and evaluate everything that's been going on within the community, and fostering more partnerships as well in order to reduce the cost of this produce, as well as increase the revenue for these farmers and these local farmers and businesses. All right, so in conclusion, we talked about the improvement of dietary reference intakes for the Oxon Hill community. We have went over the lack of affordability, healthy food options, and how that is a pressing crisis for us. And we went over our progress within District 7 to address this problem, and that was through our multifaceted approach, as well as combining education with practical access solutions, which makes it both feasible and effective. And by continuing to expand on these interventions, we can see a positive return on our investment within the community. Some of the references used in order to pull some of this information. And now the time is allowed for questions and answers. Thank you for your questions. Thank you for your answers. It's been a pleasure to present my information to you. Thank you for your time. And there will be another update as we go forward with this by the next quarter. Thank you and have a good day.